Hello, my name is Dr. Dittmann, and I'm here at the Verita clinic in Tijuana, Mexico. The reason why I drove down here is I heard about the most amazing immune protocol available today. And usually I am a skeptic by nature. If anybody knows me, you know that's true about me. However, sometimes it's important to put the skepticism aside and look at the facts and see what's really happening. That's why I came here to view in person what's going on a daily basis. Now, sometimes we think, well, if it's down in Mexico, it's across the border, it's not straight, they're not straight with the authorities in the US. I think you could put that aside and reserve that judgment. The reason why is because what you will see here is, in fact, it's extremely medically and scientifically validated by ample amount of research, first of all. And it's probably way ahead of what we're doing in the United States. I would invite you to investigate what's available here. This is the most advanced immune protocol available in the world today. That by itself is something looking into. Me, myself, I'm wanting to share this with my family, with all of my friends who are willing to listen to it. I can say one thing, is that you can trust this information, you can trust the therapies, they're safe, there's nothing dangerous or experimental about this. This is actually quite well shown to be scientifically valid, medically valid, and safe. I'm extremely excited about what's possible for not only American people today, but anyone on the planet that wants to engage and really reboot their immune system in a practical way, such that you're going to have an immune system like when you were young again. And it's available now. Thank you very much.
Your temperature.
I say the best exercise would be the application of the foot of the pedal of your car, in your car, turn the ignition and come to Verita Live here
That would be the good one.
in Mexico and get rigged up with this.
Yes.
Get set up with this, because for me that would be the best form of exercise. To tell you, I'm serious, because spending time with you guys here, I really want to acknowledge you for the great work you're doing. I mean, I interview people all over the world, medical centers, brilliant doctors all over the world. And what you guys are doing here, I don't know of any better protocol than this for supporting the immune system. And it's not just American doctors, it's German doctors. You guys get your information from the best medical scientists in the world. And we think, well, why is it across the border in Mexico? Why isn't it in the United States? People think, it's something, nefarious about it. And I'm like, no, it's just because it's just, some of these things are not necessarily standard of care in America. But, every country is different, that's all. But to me, what you guys are doing is brilliant, because you take the best of all the world's, systems to support immune function and putting it in one place where people can just come here and get the whole thing.
Yeah, and it's,
otherwise, you'd have to go to Russia, and then you'd have to go to Dusseldorf, Germany, then you'd have to go to England, then you'd have to go to some place, Russia. They have amazing things all over the world that they've discovered. So maybe in Hong Kong or China or Japan, they have amazing things there. But you guys have assembled these therapies, these systems, and you've integrated it so brilliantly. It's just very impressive. Each one of these things could probably, handle the problem. It is quite amazing.
Yes.
So
and it's not too long. I mean, here this program will take about between 3 to 5 days at the most. So it's just come in, 5 days later, so you choose a 5-day program or a 3-day program, and boom, you're out.
Wow. Yeah.
Okay, and then it will be coaching. All the questions that you may have are going to be answered, and that's what we're offering right now.
So our immune system knows what to look for.
It is.
But it just somehow needs kind of a boost to that.
It needs a boost.
Because as I've heard, you can read these in standard physiology textbooks, right? Is that by the time we're 50, we only have 15% of our immune system left. So, and it's declining at that. But, if you're in your 40s, your immune system's weaker and weaker as well. So, I mean, what would you say to the average person, say in my family, say, well, why should I go down there, Roy? And, why should I do all these things? It's like,
well, first of all, I mean, is for your own health. I mean, we need to invest in our health.
We would say, I'm not worried about this virus.
Well, yeah. Our body is not always strong enough to control it, but anything can change it.
That's a good point. I mean, there's so many other factors that constantly we're being exposed to. It's fascinating. The immune system is so complex and amazingly intelligent and knows what to do. And so what I like about the system is you're not interfering with nature in any way. You're just enhancing.
We're stimulating it. We're
our own
making
innate
it
intelligence.
better. We're enhancing it.
Yes.
Basically.
So that makes perfect sense, and it correlates to like naturopathic theory and what holistic doctors and Chinese philosophy and so forth around how to heal the body. Now here at Verita Life Clinic, you're well known for employing these really advanced immune stimulating therapies and technologies. And can you share with everybody like how this works and why does it work so well on so many patients?
Here, what we focus in is basically to stimulate your immune system. Your body is a magnificent body. It's a machine so perfect that it's able to heal ourselves. But sometimes they lose that war, especially in the immune part of it. So the only way we do, or the only thing we do here is basically stimulate it. But we stimulate it to different areas. Several vaccines. Each vaccine has a different area of working. Okay, not the same one. So it's not stimulated. Okay, everybody think, it will stimulate my immune system. Yes, but what part of our immune system? This vaccine is not an autologous vaccine. This vaccine also helps good with viruses and bacteria. This vaccine is a polysaccharide vaccine. Okay, these ones pretty much works in the specific amino acids, peptidine. These ones pretty much target the increase in production of the macrophages, the NK cells, which are going to be actively working in our immune response. It will also help to boost up the interferon. Okay, what is the interferon? Well, interferon pretty much is part of the, and believe it or not, when a cell is infected by a virus, this infected cell produces interferon. Interferon is basically allowing the other good cells, or stimulates good cells to produce amino acids that will protect them to become infected or become damaged. We use a lot of immunological vaccines. Most of them are autologous. Healing comes with the patient's own blood. Those type of vaccines, what we call it orthomolecular vaccines. And we can develop a specific vaccine for that patient. So that way we can stimulate your immune system, your specific immune system. If we want to stimulate it for cancer, if we want to stimulate it to just boost up your white blood cells. There are vaccines, also autologous, that we can stimulate your white blood cells. Our white blood cells pretty much is part of our defense mechanism. You were talking about the war. And I always try to put this example, our white blood cells, eosinophils, neutrophils, basophils, all those ones are, if we compare it, the Army, the Navy, the Marine, and the Air Force. We all have them. We take a blood sample, and then we have a check mark. Oh yes, they're present, and present. We don't know if they're really acting, if they're really working. So this specific vaccine will pretty much stimulate this part of our immune system, and it will tell them, okay, you're in the Army, so you need to go on the ground and go ahead and start fighting over there. Okay, you're the Air Force. Okay, you need to start flying around. Okay, so when something from the outside comes in, they were already going to be in place.
So it's like the army's already ready before the enemy comes, and
before
it's like they can't make a surprise
and
attack.
don't take me wrong, it doesn't mean that you're not going to have any symptoms or something. But instead of for instance, if a patient's going to get like a flu symptoms, he usually knows, okay, it was going to take me about 2 weeks, to get rid of this flu or something.
Right. Okay.
Now they're seeing that within 3 or 5 days or so, oh yes, they were going to start a flu, and then all of a sudden, oh, you know what? I didn't go through all those symptoms.
Oh, so you don't overwhelm the immune system.
Yes, because the immune system is already alert and ready to do what it has to do. This type of vaccine will basically rearrange your immune system. Whatever we have an infection, whatever we have a problem, it's like an antidote for our body. And that is specific from you. So it doesn't mean that you're going to be exposed to something foreign. It will be basically your own. And that is the beauty of these vaccines.
That makes sense, because a real vaccine should be in real time and from your own tissues. So it reflects perfectly a mirror of what you need.
What you're having a problem is where basically is going to be stimulated to go and solve that.
Right. So when they do vaccines, ordinarily, often it's from strains that existed years ago. And then, as they go through a body, they're constantly mutating. It's very dynamic. So is it even relevant to today's, strain? It's a question. But with this, it's in real time, it's right now based, it's completely yours as well. It's unique to your epigenetic and genetic.
Yeah, that way you're not guessing what is going to happen, what type of virus is going to attack this year, or what type of a problem is going to be, or what happens in the past. Right now is what's going on.
I see. What's going on. So you're doing other kinds of things too to stimulate the immune system here at Verita Life and Verita Health. Tell me more about these other methods that you have.
We also do the hyperbaric therapy. As you can see,
it's the hyperbaric oxygen chamber.
Oxygen chamber here. We pressurize pretty much, allow better oxygenation into the body. It will helps you to reduce the inflammation in your body. If there is some lesions, it will help solve them because you're going to have better oxygenation in your body. If it will penetrate deeper into your nostrils, into your sinuses, and it basically work deeper inside, and it will start getting rid of the inflammation processes. Therefore, not only having oxygenation, it will oxygenate your body better, and that way you can also be effective. Here at Verita Life, we offer certain and different therapies. One of them is heat therapy. Heat therapy, what it does, it is...
No, this is not just your ordinary heat therapy. This is hyperthermia.
Hyperthermia, whole body hyperthermia, infrared.
$50,000 instrument from Germany. This is a standard medical instrument that has, 50 years of medical research.
The Germans have been studying them for years. And they
so a lot of people might think it's some kind of hippie sauna invention or something like that.
No.
Or you're doing a sauna.
They have specific protocols. They've been using it for years. They mainly use it for cancer, but now they're seeing that the effect that the whole body hyperthermia has is not like sauna. This is infrared.
Nothing wrong with sauna, but
no. It's good.
It's good.
The heat also will create some benefits.
Yes.
One of the reasons it has good benefits, the heat treatments, is because, first of all, it allows you to sweat. By allowing you to sweat, you detoxify from toxins.
That's great.
Okay.
I was wondering about that.
One thing, it also boosts up your immune system.
So how does it do that?
How does it do that? Well, normally when we have an infection, the normal response of the body is to create hyperthermia. It's a normal physiological response of the body. So by doing so, it increases our metabolism. By increasing our metabolism, that is another way to boost up our immune system.
I see.
Stem cells, pretty much, we all have them. But as we age, are becoming less effective. And but the body constantly starts producing new cells. And they are basically used to repair our body. If a body needs to repair the eye, if it needs to repair the lungs or the kidney or any organ, the body will pretty much stimulate this cell which hasn't become anything. That is the beauty of the stem cells. They are cells that they can develop in whatever the body needs. Let's say that there's a little bit of a damage in the lung. Then the body will stimulate these cells to start producing cells that go and basically work in the lung area, or specifically the liver or the heart, where most of the start is started with the stem cells, and that is what is intended. One of the reasons we added into our immune system program is because most of the patients, like I was telling, they are with more consequences. They have problems. They have been with those issues a long time. Therefore, their body is not able to be that strong. They can have a good strong immune system, but if the organ is failing, energy-wise, productively-wise, then it's not going to be able to tolerate anything. Therefore, by using stem cells, we boost up the whole body. So the body will basically, when we give the stem cells, the body will decide what area it needs to be repaired.
Now, how do the stem cells know where to go?
Basically, the body is the ones that's going to tell them.
It has its own
intelligence. Where they need the most, where they need to repair more. But once it comes in, yes, there's a damage here, but you know what? My eyes are not also good. My lung is not also good. So part of that stem cells are going to go and fix that part of our body. Okay. So by boosting all that too, there's more chances for us to feel and to be better.
The IV drips that we are doing right now, especially for this pandemic, we're using two specific medications that are Mexican, pretty much. They're here from Mexico. One of them is Verita, which is an antiviral medication. The other one is Carcelasa. It's coenzyme A. Coenzyme A is an enzyme that is needed to go into the Krebs cycle to have a proper oxygenation. Therefore, we force that way all the cells to go into this cycle and work properly. That way will help to increase a better metabolism. It will increase the functioning of the organs. That way we can be feeling much better. The other one is Verita. Verita, this is an antiviral medication. Okay, this enzyme pretty much works at the genome in the viruses. It basically doesn't allow the virus to keep reproducing. It goes and attacks and damages that one at the biological place of the viruses, so it doesn't replicate. So that way we stop, and we can stop those two type of viruses. The RNA and the DNA type of viruses, and that is the beauty about it. So
that's interesting.
That way we can stop the load and help in that direction. Other IV medications that we use, selenium and zinc. Selenium and zinc are really also good antioxidants. High dosage of vitamin C. Vitamin C is also well known to help in flu seasons. Okay, and we use them here not only on the cancer patients but also to boost up the immune system. Nowadays, the Chinese government and Chinese doctors have discovered that high dosage of vitamin C is really effective in this type of virus.
Right.
It basically, vitamin C doesn't allow the neutrophils accumulation in our alveoli, where basically the damaged part of our lungs. So it helps eradicate that too. So high dosage of vitamin C is effective in our immune system. It will help us out with the virus, with the virus load. It's a potent antioxidant, so it also will help in that direction. Another medication that we work is thymosin alpha. This is an intramuscular medication. Thymosin alpha is a peptide that will work in a specific amino acid area. that it will increase the function of the phagocytes, phagocytosis.
So this is from the thymus gland.
This one, yes, it comes from a thymus gland. So it's really a good part of our metabolism. And it's also one of the glands that is effective through our all organs and hormones. So it will not only help you to feel better, but it will target it, especially macrophages, NK cells, to start working properly. It will also raise up the interferon. Interferon is really important right now, even as part of protocols with this virus. But one of the things that interferon does is pretty much interferon was created, or was, how can I explain this? When the cell is infected from a virus, that infected cell pretty much produces interferon.
I see.
It gives an alert to good cells to start producing certain type of amino acids to protect themselves. So that's what it does, these medications.
So it's like an intracellular immunity kind of?
Basically, intracellular immunity.
Wow.
So that's what we have here as an IV drips, and they're intended to boost our immune system.
Thank you very much, Dr.
You're welcome.
Robinson.